This is the second of the webinar sessions that we're having. We had one last week. This webinar is brought to us courtesy SAYPHIN. SAYPHIN is SAYPHIN, which stands for Society for Adolescents and Young People's Health in Nigeria, writing an abstract for a scientific conference. Now, the webinar series is part of SAYPHIN's activities to build the capacity of academic researchers. Last week, we had a very engaging and very informative session with Professor Ololade Wright and Professor Adeshola Olumide, who took us through drafting quantitative and qualitative research abstracts. Professor Ololade Wright took the quantitative aspect, while Professor Adeshola Olumide took the qualitative aspect. And I dare say that it was a very engaging and eye-opening session for us last week. So we're sure that today we'll also be having a very informative session as well to help us to improve our skills in writing our research. So today, the title of our series today is Drafting Project-Based Research Abstracts, and this will be taken by Professor Morenike Folayan, who will bring her up later. I'm your anchor person for this session. My name is Ogunyemi Riike. I'm a registrar in the Department of Community Health and Primary Health Care at the Lagos State Teaching Hospital. I'm not alone. I have a co-moderator with me by name, Elizabeth. Elizabeth Talatu Williams is the founder and executive director of Sustainable Impact and Development Initiative. Apologies. Thank you, ma'am. I didn't realize. Okay, so I was introducing my co-hosts. I said my co-host is by name, Elizabeth Talatu Williams. She's the founder and executive director of Sustainable Impact and Development Initiative. She also serves as the national coordinator of the African Youth and Adolescent Network on Population and Development in Nigeria. She recently completed the MSc in International Development from the University of Birmingham, United Kingdom. So Elizabeth, you're welcome onto this series this afternoon. Could you please say hello to the participants?
Hello, everyone. It's nice to be here.
All right, thank you, Elizabeth. So not to waste much time, because the webinar is scheduled for 2 o'clock, and we hope to be done in an hour to an hour and a half maximum. So allow me to call on Dr. Adebayo, who's going to give us a brief overview of SAYPHIN, what the scientific conference is about, and then the abstract writing webinar. So Dr. Adebayo, sir, over to you, please.
Thank you, Dr. Ogunyemi. Good afternoon, everyone. As said, my name is Ayodeji Adebayo. I'm a member of the scientific committee for the upcoming SAYPHIN conference. My job is simple, just to speak to what SAYPHIN stands for, what we do, how you can be a member, and then I'll also say a little about the scientific conference and the abstract writing seminar. Dr. Ogemi has said that SAYPHIN stands for Society for Adolescents and Young People's Health in Nigeria. It is a multidisciplinary organization that is committed to improving the physical, mental, and social well-being of adolescents and other young people. And we do this through advocacy, health promotion, health service delivery, and professional development and research. SAYPHIN is a platform for building great capacity and promoting health, research, and effective services. And our vision is to be the leader in promoting optimal health, well-being, and development of adolescents and young people. We're passionate about promoting the dignity, competencies, and capacities, confidence, character, and active involvement of young people in national health and development agenda. I'm glad to inform every one of us that we have a strong organizational structure. We have a board of advisors, we have executive officers, we work with committees. But let me say or introduce the president of SAYPHIN in the person of Professor Olusegun Fatusi. He's a professor of community medicine, and he works at the Obafemi Awolowo University, but currently is the vice chancellor of the University of Medical Sciences in Ondo State. The Secretary General of SAYPHIN is Professor Adesola Olumide, and he was the second presenter during our last week's webinar. And she's right there in our midst. And I'm sure that she is also standing in for Professor Olusegun Fatusi. Now, if you want to become a member, I've already posted the website on the chat box. All you need to do is just to click to become a member and the category of membership that you like to join. The benefits are outrageous. There are many. And the benefits could be individual level or organizational level. And that's to also mean that our subscribing to be members could be at individual level or organizational level. Let me just chip this in. The membership of SAYPHIN provides a strong platform for engaging with other experts with significant opportunities for 1, personal and professional development, 2, networking, and 3, for influencing the development of adolescents and youth health programs and policies. And we're also into advancing the field of adolescent health and development in Nigeria. We are here today for the abstract writing seminar. Dr. Guyemi has told us that it's been organized through SAYPHIN Scientific Committee, and our chairperson is Professor Lolade Wright, who was also the first presenter during our last week's seminar or webinar. So today's webinar is the second in the series. And we are here to learn how to write project-based abstract. That this will be building on what we did last week. So the ultimate aim is to be able to build our capacities or the skills and competencies of all participants to develop and submit quality abstract for the organized SAYPHIN conference. Of course, there's the thought of SAYPHIN's conference, and it comes biannually. The next one is this year. That's why we are here, and it's happening right in Lagos. In fact, it is tagged ECO 2023 from 16th to 19th August, and you can't afford to miss it. Please mark the date in your diary. Thank you. Over.
I think she wants you to take it on. Maybe we just take it on and then we just go from there. And we truly don't have the time yet.
Okay, at this point,
So,
I think Elizabeth should introduce the speaker. Is Elizabeth on the call?
Yes, I am. Okay. Thank you, Doctor.
Okay, Elizabeth, please go ahead. Yeah.
Yes. Thank you so much for that brief summary of SAYPHIN. I will be going ahead to introduce our speaker for today. It's a pleasure to introduce her. She's a mentor to myself and to many young people out there. Professor Morenike Oluwatoyin Folayan, she is a professor of pediatric dentistry at the Obafemi Awolowo University, Ile-Ife, in Nigeria. She is also the board chair for Atlant Alliance International, Nigeria, and she is the current dean, Faculty of Dentistry, Obafemi Awolowo University, Ife, Nigeria. She'll be taking us on what it takes to write a project-based research abstract. Please, if you have any questions while she's presenting, kindly drop them in the chat box, and all questions will be taken after our presentation. Thank you. Prof, you can go ahead.
Thank you so much. Thank you, Elizabeth, for the introduction. Thank you, SAYPHIN, for inviting me. And just to also announce that I'm a very proud member of SAYPHIN, and I've been there from the very beginning. And yes, this is the second time we're doing this series. We did it the last 3 years when we're doing the last project, and we're doing this now. For those of you that were here last week and listened to the project presentation, you probably will be saying I'm repeating the same thing. It's because, one, abstracts have the same, it's the same thing, whether you're writing different this abstract for conferences or you're writing project-based research, abstract qualitative research, quantitative research, the principles are the same. So my aim for this session is to take you by your hand and lead you through a process of writing quality research, quality abstracts. I want to believe that if you can learn this process and successfully submit an abstract for the SAYPHIN conference, you would likely be able to submit an abstract for any high quality international conference. So let's go together. Stay with me throughout this presentation, because towards the end, we are jointly going to do a project together. My name is Morenike Lion, and they've introduced me. But most important, I think the most important piece of the introduction is that I am a proud member of SAYPHIN. So what are abstracts? And there are different types of abstracts. You could write an abstract for a conference. You could submit it for a manuscript. If you are in a postgraduate school and you've done, you're doing your master's or your PhD, even undergraduate, you might have to write an abstract for your dissertation. Many times in the dissertation is referred to as summary. If you want to write a book, they will tell you to write an abstract. It's a book proposal to the publisher. You would write it in the form of an abstract. If you write and submit for a grant, a piece of work you see.
Okay, apologies. It's our internet, and she's sorting it right away. Elizabeth.
Okay, thank you. Thank you, Dr. Bayo. Okay, so while we wait for Prof, I think we can just ask our participants to please introduce themselves in the chat box, your name, your organization, so that other people can get to meet you and can get to know you. Dr. Guyemi, welcome back.
Yes, thank you very much, Elizabeth. Also, while we're waiting, in the chats, we already have the link to register with SAYPHIN. So please go ahead. Okay, so Grace Donia says that the link is not accessible. Dr. Adebayo, I don't know if you want to help us look at that, sir.
That's SAYPHIN link?
Yes, sir.
Okay, all right. I'll do that.
The link is not accessible. Thank you so much, sir. Okay. So I don't know if Prof is back on the platform.
Not yet.
Not yet. Okay. So we'll just hold on a little while. So in the meantime, as Elizabeth said, we could just have people introduce themselves. Let's know which part of the country you're from. And it's raining heavily here in Lagos. So probably that's what is affecting Prof's network as well. Okay. Thank you.
Apologies, everyone.
You're welcome back, ma'am.
I'm really sorry.
Yes, Prof, you can go ahead.
Thank you.
Welcome
I truly apologize. I'm sorry. I had an internet problem.
That's fine.
So like I said, we could have a conference abstract, manuscript abstract, or dissertation. The first three, however, will always have a component. You have a result to discuss. Really, you must be very exceptional for them to bring you onto a conference and invite you to do a presentation of something you are yet to do, but you are proposing to do. Many times, conferences will not ask for those kind of abstracts. They may find your work extraordinary, and then they will call you to come and make such a presentation. But when a call is placed out for you to submit an abstract, it is expected, when it is a conference abstract, a manuscript abstract, or a dissertation abstract, that you will be writing an abstract that has a completed piece of work. Okay, so now let's look at project-based manuscript and research. What do we refer to in this seminar or this webinar when we talk about project-based research? We believe that project-based research resolves real-world problems. They are field piece of work. They may have an abstract that they want to submit for conference presentations, but they can write a manuscript from their piece of work. The project-based manuscript is expected to submit an abstract to a conference based on a piece of work that is ongoing, but for which they've generated results that has meaning, or the end of that piece of work. I repeat that. When it's a project-based research, it's usually 2, 3, 4, 5 years. They will generate information at various points in time. They might have information at baseline. They might have information at 2 years, 3 years, or completed piece of work, they can submit abstracts for those various timelines. And usually project-based research will generate qualitative and or quantitative data. This is usually what happens. It might be generated through monitoring results, the results of their monitoring of their project, and usually that is qualitative, or it might be an evaluation, which might be midterm or end of term. Many times, evaluation results are mixed results. They generate data using both qualitative and quantitative. Talking about conference abstracts for projects, like Dr. Wright and Professor Wright presented last week, it can be structured or unstructured. I talk about structure that usually when you present many times when you're dealing with quantitative or qualitative per se, and you're presenting it, it's structured. It's just that the sections are not written. So usually an abstract will have an introduction or a background, the method, the results, and the conclusion as content. When it has sections, you write introduction or background, and then you write what you need to write. You write a method, then you write what you want to write. When it's not structured per se, it doesn't have those sections, but you will be able to identify these 4 categories. You will identify it clearly without them writing the titles. So it's structured. However, when we're talking about a project piece of work, you might also be writing, reflecting your field experience. And in that kind of abstract, you will write an introduction, a method, lessons learned, rather than results, and then a conclusion. I repeat that. The difference is that there isn't a result. What he's talking about here is lessons learned, which means you're going to be sharing perspective. And I'll be talking about that. I'll be sharing a little perspective about that as we go on. So yes, let's go on to writing an abstract. That you've already seen, whichever abstract you send, there's a principle to it. It is basically the same thing. And then together we'll review an abstract. I am going to share with you from my perspective as an abstract reviewer. And this is what we look for when we are reviewing abstracts.
Hello.
So that helps you to know what it is, to be able to get your scores if you submit an abstract for a conference. We would expect, whether it's structured or not structured, that there's a background to what you're writing. As noted in the last week's conference, then there usually would be word limits: 250, 300, 350, 500. Exceptionally, it's 500. Usually, it's about 300, 350. And believe me, you can write a lot. You can write a summary of a 1,000-page document in 300 words. Believe me, it's skills. You can do it. When we look at the abstract, there are 2 things you look for in the background. A sentence that highlights the gap in terms of the study you are writing. What is the gap? It's just a sentence. 2 sentences are too much. 1 sentence that highlights the gap, and the second sentence highlights your study objectives. Those are the 2 pieces of information we're looking for in the background. When we're looking at the study objective, there are things that are looked for in the study objective. Because once the objective is not right, the entire work is warped and you will not get your scores. Because your entire piece of work is driven by an objective. An objective has to be clear for me to be able to review the rest of your abstract to be sure it links properly with your objective. I recall Professor Olupide was sharing this last week, that from your background to your results, to your methods, to your results, your conclusion, everything must be linked. You must be able to see a thread. And the thread starts from the objective. So your objective has to be clear. It's an active statement of how the study is going to answer the specific research question. And it determines how you choose your building blocks. And we'll see how those things matter as we go on. When we look at an objective, the objective must be SMART. I'm sure if I ask you all to show by show of hands, if you've heard the word SMART, I feel very confident I'm going to get a response 100 and 100. But how does this translate to your study objective? And I'm telling you, once the objective is wrong, it's not likely you're going to get away into your abstract moving forward. I'll share my experience in reviewing these abstracts also. SMART is an acronym. S stands for specificity, M for measurability, A for achievable, R for reliability, and T for time bound. And we do look for it when we're reviewing abstracts. So let's start with the S. When we say an objective is specific, it means the objective is precise. There's no fake statement. We know exactly what we want to do. And let's look at this objective. I write to determine the association between demographic profile of females and their menstrual cycle. This objective is not specific because why? Though it is saying it is going to determine the association, it's talking about determining an association between demographic profiles of females. What demographic profile are you looking at? There are over 50-something demographic profiles that you can choose from. And nobody is going to expect that in an abstract, you're going to explore 50-something demographic profile. Many times when people write this kind of objective, it is likely they're going to look at sex, age, and socioeconomic status. They're not looking at socio-demographic profile in its entirety. So remember, once again, specificity is about precision. Science is about precision. And therefore, when you're listing and telling me what you were looking for in terms of your association, there must be precision about it. Right now, saying you're looking for an association between the demographic profile and whatever is not precise. Second, there's imprecision about referring to females. They could look at females who are infants. We can look at females who are toddlers. We could look at females who are preschool children. We could look at females who are school-age children. We could look at females who are adolescents. We could look at females who are young persons. We could look at females who are adults. And we can look at females who are elderly. For this study, there's imprecision in stating that you are looking at females because I have no idea what category of females you're dealing with. Even if I choose to deal with females who are adolescents, knowing very clearly that adolescence is 10 to 19 years old, if I am studying adolescents at 12 to 15 years old, it is very important that I'm specific about that because I am not looking at the adolescent in its full spectrum. I am looking at adolescents 12 to 15 years old. Another unspecific thing about the study, one might talk about menstrual cycle because there are 4 phases there. But maybe you're looking at everything, which is perfect. But this title has not given us where the study is holding. Is this a global study? Is this a study of females in Nigeria? Is this a study of females in Osun State? Or is this a study of females in Ile-Ife? Or is this a study of females in Obafemi Awolowo University? Therefore, when I say this kind of objective, I am very sure I can deal with this when I'm looking at every other thing because there is no direction and there will be no conclusion for this kind of study. Second piece of what you want to look at in the objective is the measurability. The objective needs to draw boundaries around what you want to explore. And many times you draw those boundaries by dates or time. Let's look at this objective. This person wants to identify the relationship between socio-demographic profiles of females and their menstrual cycle. We already know that the socio-demographic profile and the word female makes it unspecific. But there's something, once again, that makes it unmeasurable. If you look at the preceding one, this person talked about determining an association. In this objective, this person is trying to identify the relationship. This is unmeasurable because in statistics, you cannot measure relationship. If you're doing a quantitative research, you cannot measure relationships. If you're doing a qualitative research, you cannot identify relationships per se. So this is a tough measure. If I'm doing quantitative, it's either I'm looking for association, I'm looking for trends, I'm looking for impact, I'm looking for effect. That is measurable because there are statistical tools to measure this. So for this objective, if I see this, there is a problem because what is being measured has not been defined. When we talk about achievable, we'll want to look at what is practical and doable. We'll look for objectives that are possible and researchable. Therefore, let's look at this objective. This individual wants to measure the impact of age and ethnicity of 15 to 19-year-old females on their menstrual flow. This objective, when you compare it with others, have been brilliantly improved on. The fact that this individual wants to measure the impact of age tells you that this is measurable. It's also very specific. It's about 15 to 19-year-old females and not just females. And it's about menstrual flow, not just the menstrual cycle. But if this person is going to do the study in Nigeria, this is an unachievable objective, because in Nigeria, we have over 350 ethnic groups. And therefore, it is impossible for you to measure the impact of age and ethnicity of 15 to 19-year-old females on their menstrual flow in Nigeria. It might be possible if you're going to do it in other clans where there are just one or two ethnic or divides, like the whites and black or white, black and Hispanics. But if you're doing the study in Nigeria, you can't measure, you can't achieve this. This is an undoable thing, or it's going to take you 25 years to finish this kind of study. And why did I refer to 25 years? Because first of all, this person is going to measure impact. You cannot measure impact in 1, 2, 3 years. You start to measure impact at 5, 6, 7, 8, 9, 10 years. This is why I say once again, your objective is your direction. It's the building block for your study. If this person says, I want to measure the impact of age on, the menstrual flow, I would assume that this person is designing a longitudinal study. This person cannot be measuring impact and then end up, I go into the methodology and I see a cross-sectional study. That's the end, that is zero. Because a cross-sectional study can never achieve the measure of impact. It's going to be a longitudinal study. And if it does a longitudinal study and it comes to report at year 1, I know this is not answering its objective, because you cannot measure impact in year 1. It's just like our COVID. You could not have measured the impact of COVID in year 1, year 2, year 3. You start to measure the impact of COVID at year 5, year 6, year 7, maybe year 3, maybe you start to see something. But impact connotes time. Effect connotes time. Cross-sectional connotes time. Association connotes something. Trend connotes something. Correlation connotes something. When you're putting those kind of more words as your measurability, it affects the design of your study. Next, we talk about reliability. Reliability refers to consistency in your measure, which means if I do the study today and I repeat it in 5 years' time, with everything remaining constant, it must be reliable. So let's critique this objective. This individual wants to determine the association between dress colors and the mood changes of adolescent females during their menstrual period. This objective is measurable because it's talking about associations. And I would assume it's adolescent females. So it's not all females are anywhere in the world. So there's specificity in this objective. It's also menstrual periods, okay? However, there is unreliability. For this person who wants to measure dress colors, there is no way there's consistency about dress colors. The fact that you wear a blue dress today, once you put it in water and move it out, the color changes. And we all know colors and women. It is magenta green or Valencia blue or sky red or pepper green or coconut brown. There is inconsistency in dress colors. The worst is that there are no tools to measure dress colors. One might say there might be inconsistency in mood changes, but there just might be a psychometric tool that can measure mood changes. So when we're talking about reliability and you're going into your methodology, please note that you must show us the tool that you use to measure your phenomenon with consistency. So you must be doing your work using a reliable or a validated tool. There is no point at this time developing a tool that you created yourself and it was not validated and you start to report the result. Reliability is key. which is why you want a reliable abstract that people can quote and translate it into policies and programs. Time-bound also matters. Project milestones. When did you collect this data? If you collected the data in the year 2020 when there was lockdown, you're not expecting that same result to happen in 2023 when there's no lockdown. And you cannot also expect that result to be the same and applicable in 2014 when there was nothing called Ebola or COVID or, the world are different in these time places. So when you are doing your work, time relatedness is very important. For example, we look at the study who says the objective is to conduct a systematic review, very measurable, of the effects, very measurable, achievable, of climate change on menstrual flow of adolescents 15 to 19 years old. Specificity, but there's no time bound. Are you going to be looking at systemic review from the beginning of this world till now? Because climate happened from the beginning of this world. Or are you looking at doing a systematic review of the last 5 years? Or are you looking at it from 2020 to 2025? What is it that you're looking at? Time-bound matters for us to get good objectives. Once again, note that when you write an abstract, your objective must be very clear. Your objective is part of your background. And the clarity of your objective is the beginning when a reviewer starts to link up with what you're doing. It looks at the objective, expects issues that your objective has raised, and then I go on to look at your method. It must answer the objective. Your conclusion must also answer the objective. So you've moved on from your introduction and now your method. Your method must have the 6 details. You must open your sentence of your abstract telling us what the study design is. Is this a mixed method research? Is this a cross-sectional study? Is this a systematic review? Is this a clinical trial? What is your study design? It must next tell us what the target population is. And the next thing is to tell us the study location. Next, you must tell us about the date when the data was collected. And then you must tell us what the study variables are. And finally, it's important to tell us the data analysis tool. Was this descriptive? Was this a test of association? Was this, a logistic regression? And when you talk about logistic regression, when you're doing quantitative data, you want to tell us what type. Is it binary? Is it multivariate? Is it multinomial? If you're doing qualitative, you want to tell us what did you do. Did you do a deductive analysis? Did you do an inductive analysis? Did you use count theories? These are things you want to state categorically. And next after that, you talk about your results. Your results start first with your sample size. Whatever it is, if you did a focus group discussion, if you did an IDI, what was your sample size? You want us to know. You tell us, give us a brief description of your variables. If you, the number of your variables, if you did a quantitative study, and what is the outcome of your differential analysis. This is one of the weakest points in many people's abstracts. When you do a differential analysis, and like you say, you did logistic regression, and you do not put the statistical findings, you do not put your adjusted odds ratios, you do not tell us your confidence intervals, you do not put your p-values, nobody's going to believe you. Because those results, those abstracts can be cooked up. You tell us that you have a mean, and you did not put your standard deviation. Nobody's going to believe you. Because you would only generate a standard deviation if you have touched the computer. You can generate a means by waking up and just putting figures. So those statistical figures in your abstract matters because that is the make or break of anybody believing the figures. Except the conference categorically states don't put figures. I know journals that says don't put figures. Please ensure those figures are there. Once again, ensure that your result is answering the study objectives. Don't go telling us things that you start to find interesting. We're going to review an abstract shortly, and you're going to see how this individual also deviated from the results because they're interesting things that they're really interesting. But this is not the time to share interesting things. This is the time to answer your objectives. So focus. And finally, you conclude. When you conclude also with 2 statements: the answer to your study objectives and your recommendation. Please note that your recommendation must be based from the evidence that you derive from the study. It must be linked. It can't just come flying from anywhere. It must be found linked to the study. And the last thing you do after that is the study title. You have done that. Of course, there might be a study title that starts, but then you now start to pull it together. It's the last thing you write. And anytime you write your study title, it must contain the study design, your study variable, your study population, the location. This is when it comes to manuscript writing, it is very precise. There's no fanciness to it. But when it comes to conference, you can put the fancy one. Use eye-catching titles. Is this the end of the world? Magadon has come. Or, those kind of eye-catching title is very, very welcome, because you need somebody to catch the attention for them to go on. It's not for we as reviewers per se, but for your audience who's going to be choosing which abstract section they want to go. So your catchy titles allows them to even read the abstract first. And then when it's interesting, they might want to come to your session to lead them. One of the ways to make it very, very catchy is to link it to topical issues. We're now in SDG ages. Talk about SDG. We're now universal healthcare. Link it to universal healthcare. We're dealing climate change. Talk about climate change. Link those things you're doing to topical issues, and then it kind of move off. So now, also, before we go to review, you're going to stay throughout this with me, everyone, and be ready to use your app in terms of raising your hands. And then you're going to use the chat box. You're going to do a lot of chat boxing. Last week, we talked about how you do, finish your abstract, the little things that matter. Once again, I recall last week, he was shared that you cannot write an abstract at the last minute. But I remember Professor Olumide saying that you must be a guru to do last minute. No, even if you're a guru, you can't do it at the last minute. You write abstract well ahead of time so that you can revise and do the little finicky things that needs to be done. When you use words, there's precision that is required with abstract. It is because of the precision. Science is precision, and it requires precision. Every sentence you write must not be subjected to multiple interpretation. It must say exactly what it means. You cannot write and I interpret it somewhere else and say, no, this is not what I mean. Then it means you did not say what you mean. And that is the problem with writing abstract that are not specific. What is not specific is not precise. And then people are expecting things in their mind and they don't see. And because they're expecting things in their mind they don't see, they will judge you based on what they're expecting in their minds. If you are specific, they cannot think otherwise because you have said what you want to do. So you must pay attention to the choice of your words and word arrangements. Mastering the fundamentals of scientific standards, it's not genius. It's about doing. Nobody was born with it. Every single one of you, the 100 participants on this line are geniuses. Each one of you are geniuses. It's about continuing to do and apply the principles you have heard from last week to this week, and then you become an expert. Just follow the principles. It's a word game. It's crossword puzzles. People become expert at chess. People become experts at crosswords because they apply the skills. Abstract is a word game, and the winning combination results in beauty. That is barrier-free communication, and that gets you the score and gets you invited to come and present an oral abstract. And I like this. Let's do a few exercises. Dr. Dempsey says that in a scornful tone, that when I use a word, it means what I want it to mean, nothing more, nothing less. When I use a word, it means just what I want it to mean. I'm using this example, the first two words, based on some of the things I see many times we write, even in an abstract or a title, and we're not saying what we mean. Let's look at title 1. Determining the prevalence of jaundice in preschool Nigerian children. I see this kind of thing very often. So this person's objective is to determine the prevalence of jaundice in preschool children, preschool Nigerian children. And then in the methodology, this person does not ask about country of origin. So how do you determine that the child you recruited was a Nigerian when you did not determine the country of origin in your methodology? But many times, these people do not mean that. What you meant is that you wanted to determine the prevalence of jaundice in preschool children in Nigeria. Therefore, you do not need to determine the country of origin. Every child that is preschooler in Nigeria will be recruited into your study. These are the kind of things that happen in your use of words when you are writing what you do not mean, and you are leaving me as the examiner to interpret what I understand by your statement. Let's look at the second one. This might not be what we mean, but this is very critical. The risk of cancer in HIV children. I am very sensitive to words, and many international people and top researchers are very sensitive to words. When you use this kind of words, they're very stigmatizing. The risk of cancer in HIV children is stigmatizing. The right phrase is the risk of cancer in children with HIV. And this is the key word in communication. People first. Can you repeat that after me? People first. Repeat it. People first. Let's say it together for the last time. People first.
People
Thank
first.
you. So you can say
People first.
People first, exactly. The risk of cancer in children with HIV is people first. The risk of cancer in HIV children is not people first. When you want to avoid stigma, you put people first. The risk of cancer in children with HIV removes the stigma. And this matters when you're communicating. Another thing you must take consciousness of is the words you use. Avoid biomedical jargons. We use those words, that you think everybody knows, but you don't know. Like Professor Lumide said last week, oh, that thing is bad. But if you go right bad, that adolescent is not saying bad the way an elderly person is saying bad. Bad is good in the adolescent jargon. You can't use those kind of jargons. Avoid coining new words, new phrases. Use what is conventional. Minimize the use of acronym. One of the things I see over and over is this use of acronym. Listen to me, you only use acronyms or abbreviations when you have used that word more than 3 times. Read my lips. More than 3 times. You only use an acronym or an abbreviation when you have used that word more than 3 times. It's not because it's popular. So you write PEFA, then you put PEFA and then continue. CDC, you never use it more than that once. WHO, and then you write an abbreviation. It's really annoying. Okay, so please, and when you can avoid it, you do not use it. Where you can avoid it, do not. I was taught that by my editor. You don't use it if you can avoid it. Be conservative with new terminologies and read over your word. That's why you cannot write your words at the last minute. Not even I don't do it. You must read over your words for bias. The speakers last week, Professor Wright emphasized, you must give yourself time, write it so that you give your colleagues to read over it, because they will see things you do not see and they will cross. They can help you cross some T's and dot some I's that will make the difference. I will go, my next session will take us through what I mean when we're talking about bias. Avoid the use of value-laden terms that make people know what side you are. Remember that you're a researcher, no matter where you're coming from, even you're project-based, and you must be presenting a balanced opinion, very balanced. And therefore, when you are starting to reflect where your value is in your statement, you're going to throw people off and you're going to lose your marks. So let's start to look at what we mean about value-laden words. Using man to refer to human beings carry the same implication when we're in a world that is looking at the difference between man and woman. So use gender-neutral words. You don't say mankind. Say human race. You don't say policeman. Say police officer. Are we together? Use those words that are not value-laden, because we are in a world where there's gender sensitivity. When we talk about marital status, sexual orientation, race, and ethnic identity, people with disability should not, this identity should not be mentioned, gratuitously, avoid languages that label them. It's very common in our language to say normal girls. Innocent childs. So when I say normal girls versus lesbian girls, are you telling me lesbian girls are normal? That's the connotation of your words. And therefore, if I am a lesbian and I'm reviewing your statement, you're okay. So if I'm reviewing, I'm a lesbian and I'm reviewing your abstract, and you're saying normal girls versus lesbian girls, which means I'm an abnormality, you're already going to be negative. And I'll talk about native intelligence when I get to the end. Native intelligence matters. Avoid languages that label. Finally, avoid a language that is about a dichotomy. We are there. They are always sick. They are, when you're writing your results, you are referring to them as they. When you listen to that people first language, you will find that you can avoid the dichotomy. They are always sick. People with immune defects are always sick. You don't need to say they are always sick. People with immune defects are always sick. So there's no dichotomy. Once you are saying they, then you are dichotomizing, and many times you're putting yourself on the superior end, and it sounds judgmental. Okay? So once again, the difficulty is not to write, but to write what you mean. And now let's start to look at a few of those things. In my recent years, one of the things I've seen in writing is the issue of punctuation. I cannot even believe it anymore. You see number one, people don't even know people how to use paragraph. It's becoming more and more difficult to understand paragraphs. The next thing is, I had read a whole transcript. I'm telling you, I'm not faking. And everything was comma. There was no full stop. And I couldn't believe it. A whole transcript, about 8 to 14 pages. So punctuation matters. Remember, once again, you have to say what you want to say with precision. So let's look at this. The professor directs the student to punctuate this word. A woman without a man is nothing. And that's two sentences, two different meanings based on punctuation. The man wrote, a woman, comma, without a man is nothing. A woman, comma, without a man is nothing. In effect, a woman is nothing. The only thing that makes a woman something is a man. The woman wrote, a woman, colon, without her, man is nothing. In effect, a man is nothing without a woman. These are the same words, two different meanings based on the use of punctuation. Believe me, punctuation is everything. And punctuation has one purpose: to help the readers understand the structural relationship within your statement, your sentence. That last minute, when you give people to read over your abstract, they will help you with this punctuation marks and enhance your ability to communicate effectively whatever it is that you want to say. Now we have this exercise we're going to do together. We're going to look at abstracts that are project-based abstracts, and we're going to score them. 98 of you now are going to be reviewers. And usually this is how we grade. And you're going to grade these abstracts, okay? And they are project-based abstracts, so we're going to look at them together. Usually grades are given on a range of 5. They can say, ICASA says 5, I think IAS also says 5. Some would say it's over 10, says over 15, some says over 20, some says give 100. But you see it's in the mark of 5. So you can multiply this. When they look at the background, they'll say score 1. A statement problem, 0.5, objective 0.5. Many times they don't structure it like that. But when we're saying a background means two things. There must be two sentences there. Your statement of problem, 0.5, your objective, 0.5. If you don't write a statement of problem, then you've lost mark. The methodology is 3 marks. If there's anything any one of you are noticing here, is that the bulk of the marks go to the methodology. I repeat, the bulk of the marks go to the methodology. When you have an abstract of 500 words and you spend 250 words writing your background, that's going to get 1 mark. You can be sure, but without any extrapolation, that abstract is either going for a reject or an e-poster, if they like it. The methodology is the big deal. The methodology is the big deal. Whether you're writing it for conference or for manuscripts or for grants or for book proposal, the methodology is the big deal. Remember that your methodology, remember when I talked about the abstract, your methodology has 6 things that you must see. You must see the design, you must see the population, you must see where the study was conducted, the date that the data was collected, the study variables must be there, and then the analysis you did. Each of them takes 0.5 marks. And then finally, we want to see the results, and then we want to see the conclusions. Now, I hope you've all listed the scoring strategy. Every one of you, please write it briefly, and we're going to go together to review abstracts. So this is a project-based abstract, and this is a sample of an abstract. They're doing a study on the uptake of pre-exposure prophylaxis by men who have sex with men and female sex workers in Nigeria. And they're looking at community perspective. So this is at the beginning of the research, and they needed to define some variables before they go on to design the implementation of that project. Guys, look at that title. There is no acronym in the title. Okay? We're not marking title now. But this is it. There are no acronyms. It's precise. It goes on. Okay? So let us go to the background. Everybody, my facilitators, that's Oguyemi as well as Elizabeth. Oguyemi, I'm going to assign you to help me to harvest the scores for abstract A. And Elizabeth, please help me to announce the scores for abstract B. Every single one of you are an abstract reviewer today, and you're going to score. And when I ask you to score, you put the score in the chat box. Once you put it in the chat box, please, Ogunyemi, you're going to announce all the scores that they write for abstract A. And Elizabeth, you're going to announce all the scores for abstract B. At the end of this presentation, you tell us the scores. So abstract A and B wrote this background. Men who have sex with men, female sex workers, have critical needs for effective HIV prevention tools. The aim of the study was to identify the perspective of female sex workers, MSM, FSW, and policymakers on the needs for, barriers to, and challenges with pre-exposure prophylaxis and logistic requirements to support the rollout of PrEP for MSMs in Nigeria. Please give me just 1 second, guys. Just give me 1 second. So now let us take it. Remember that the background must contain 2 statements. What is the problem and what the objectives are? So now everybody score this over 1. What would you score? This is the background for both abstract A and abstract B. So guys, over 1, what would you score this person? This is the background. A background expected to have 2 statements. Men who have sex with men, female sex workers have critical needs for effective HIV prevention. So the aim of the study was to identify the perspective of MSM, FSW, and policymakers on the needs for barriers to and challenges with pre-exposure HIV prophylaxis and the logistics required to support rollout of PrEP for MSM and FSW in Nigeria. Please put your scores. Remember, background has 2 statements. The scores is just 1. Please put it in the chat box. Okay. Very good. So we're saying thank you, Latifa. Thank you, Juliet. Victor scored 0.5. Okay. But this is the way it goes. All right. Very good. So put your scores. I'm not seeing scores. We're 100 people. We're 100 people on this call, and I'm not seeing the scores from 100 people. Very good. Thank you, guys. Thank you very much. Okay. Good. So please, as well as Elizabeth, please, I've missed the scores for each one of them. Thank you. Now let's go to the methodology. This is methodology for abstract A. Abstract A. Remember, guys, when you do the methodology, the scores for methodology is 3 marks. 3 marks. We look out for study design, study population, study location, date of data collection, the variables, and the data analysis. So this guy, method A, says, qualitative and quantitative data was collected through a cross-sectional study. The quantitative data were collected through an online survey administered to 519 MSM and FSW. The Qualitative data was collected through 22 focus group discussions with 140 MSM and 80 female sex workers, FSW, and a 2-day consultative workshop with 65 participants. 2 open-ended questions in the online survey was also a source of qualitative data. Results of the quantitative data was reported descriptively. The qualitative data were inductively examined with a content analytical process to construct descriptive categories. The findings from the quantitative and qualitative response was triangulated. So let's look at this. Study design, is it there? It says I collected qualitative and quantitative data through cross-sectional studies. I would frown at it because you usually will not collect qualitative data through cross-sectional studies. Study population, it says there. You can infer, it did not tell you who they are, you can infer that this person worked with MSM, female sex workers, and nothing else. You can't find anything else, okay? But go back to the objective. It says it wants to find out the perspective of female MSM, FSW, and policymakers. You look at the method, you can't find policymakers, okay? Study location. Can you find study location here? I can find study location. Date of data collection. Can you find the date of data collection here? No, I can't find the date of data collection. Variables that were collected. What was the variable collected? Can you find them here? No, I can't find them. Because when you go back to the objective was clear. I want to identify the perspective on needs for, barriers to, and challenges with. That's 3. The 4th one is logistics required to support rollout. It wants to collect 4 variables. How did they define the variables? It's not there. It's not here. Okay. And then the data analysis. Yes, you can find data analysis. It says that descriptive for quantitative, but for the qualitative, he did a deductive analysis and then he triangulated. So this is the methodology for method 1. Now, guys, can you score this person over 3? You will expect that the study design is 0.5, study population is 0.5, study location is 0.5, date when data was collected is 0.5, variables are defined 0.5, and the data analysis. Can the 98 participants please score this person over 3? And can Ogunyemi please address the score? Okay, very good. Thank you. Excellent. Okay, so I'm going to go to method 2. This is somebody that is writing exactly the same method for the objective we saw. This person went on to write. This was a mixed method study that collected data from MSM, female sex worker, and policymakers between June and September 2020 in 6 states selected from each geopolitical zone in Nigeria. An online survey was administered to MSM and female sex workers to identify the perceived need for PrEP and barriers to accessing PrEP. The qualitative data were collected through 3 focus group discussions conducted in each state and 2 consultative workshops, one in northern and one in southern Nigeria, with policymakers to explore causes of challenges with access to PrEP and logistic needs to roll out PrEP for MSM and female sex workers in Nigeria. A descriptive analysis was conducted for the quantitative data. An inductive analysis was conducted to construct themes for the qualitative data. The findings from the qualitative and quantitative data responses were triangulated. So for this study, can you find the study design? Yes, it's a mixed method. Can you find the study population? Yes, MSM, FSW, and policymakers. Can you find study location? Yes, the 6 states in the geopolitical zones in Nigeria. Can you find when the data was collected? Yes, June and September 2020. Can you find the variables very clearly? For the online survey, he looked at only 2 variables, the perceived need for PrEP and the barriers to accessing it. Through the qualitative study, he looked at 2 other variables, the logistics for rollout and causes of challenges. This study has addressed the 4 variables. He has told us the 4 variables that he or she wanted to explore in the objective and how it had been explored. The data analysis, was it defined? Yes, with clarity. A descriptive analysis was conducted, an inductive analysis was conducted, and the results were translated. So, guys, for methodology, there are 3 marks for objective B. Can you score this guy for methods B? Let's roll it. Let's roll it for method D. And can Elizabeth please nurse it? Method B has for majority 2.53, 333. Excellent. Okay, guys, let's go. So now he wants to report the results. Let me tell you one other thing about method A that was a gap. You can see that this person is talking about the sample size already in the method. Method is usually found in the result. Sample size is found in the results, not the method. So let's look at the result of A. And I went back because it's going to be a challenge. So its results. 494 online responded had heard about PrEP through community dialogue. And 439 supported its use. Fewer than half of the responses were aware of clinical care required for PrEP, and misconception about PrEP was common. The stated barriers to PrEP uptake was stigma, cost, frequency of HIV testing required, possible drug-drug interactions. Concerns include possible condom migration, increased risk for sexually transmitted infections and pregnancy for female sex workers, poor adherence to medication and hospital schedules. The participants felt that the training of peer educators and HIV testing counselors could provide information and refer clients to clinics that provide PrEP. PrEP can be provided through peer-led facilities for MSM and female sex workers, though its access should be expanded to all people who are substantially at risk so as to prevent negative labeling of PrEP. And PrEP awareness about the use of antiretroviral for HIV prevention is needed to prevent labeling of PrEP users as being HIV positive. All right, I'm sure some people are already scoring. So this person, the result, you only score 1 though. It's only 1 mark, okay? But you can look at this person. One of the things why I wrote this is that this is really low. This is my abstract. It's my study. You can see that this person is starting to write results that has no link to the objective. It says they generated PrEP through community dialogue. Did the objective say, well, how did you generate PrEP? How did you know about PrEP? It's not there. It's just answering his own question that it didn't state in the beginning, okay? It says fewer than half of the respondents were aware of clinical care required to PrEP. It is not there. It's not a study objective. It's reporting half of the respondents. And misconception about PrEP was common. It is not part of the question. He has answered things. So that's not the kind of thing. So you're starting to write results that has no link with your objective. The objective did not ask you about community. Where did they hear about PrEP? It did not ask you about the awareness about clinical care. It did not ask you about misconception. You are reporting it. These are very interesting things, but it's not your objective. Now, by the time you read all these results now, who was saying what? Which one is qualitative? Which one is quantitative? You have a problem. Okay, guys, now, score this guy. Don't be cruel, though. It's 1 mark. You don't have to give 0. Score this guy. Okay? All right, let's go. Let's 1, 2, 3, 10 seconds. Score this guy. 99 people were expecting a score. Okay. So let's look at the second guy that writes a result. This result says there are 591 MSM and female sex workers online survey participants, and 140 MSM and 80 female sex workers who participated in the focus group discussion, and 65 policymakers who participated in the workshop. So this person has defined the sample size, defined the need for PrEP,
and very important.
Supported its use. 395 felt barriers will limit its uptake. That is what the online survey, and because the online survey, what did the online survey say it was going to look for? Let's look at it. Remember his methodology. He says an online survey was administered to identify the perceived need and barriers to. That is all. His result. He says 495 identified the need for PrEP. The 400 that was supported its use. That one is extracurricular already. 35 felt barriers will limit its uptake. Finished. And then when you went to the qualitative, look at his method. It says the qualitative study were collected through focus group discussion and consultative meetings with policymakers to explore the causes of the challenges and the logistic needed to roll out. The third thing the qualitative did. So you can see in his result that he answered barriers were stigma, cost, treatment services, possible drug-drug interaction. Concerns include condom migration, increased risk for STIs, poor adherence to medication, increased risk for pregnancy for female sex workers, and respondents felt these challenges could be addressed by training peer educators and HIV test counselors to provide that. PrEP can be provided through peer-led facilities for MSM and female sex workers. PrEP should be provided to all persons who are at substantial risk to prevent negative labeling. Public awareness will prevent the labeling of drugs for users of PrEP as people living with HIV. Very clear. Because these other ones were qualitative, he didn't have to put percentages because it was derived by qualitative and he answered. But you can be sure that the person who wrote this abstract did not give it to his peer to review because you can see a comma where there's supposed to be a full stop. Are you with me, guys? All right, let's call this abstract over 1. 99 people. Lawyer, go ahead and score. And Elizabeth, please address the results. Let's go. In 10 seconds, please score. Yes, 1 person, 2. I've seen 2 persons score, 3 persons, 4 persons, 5, 6. Yes, please go ahead, score. I need 10 more scores, and then I go to the next section. Thank you, guys. Very good. So now the conclusion. This person concludes, although MSM and female sex workers are interested in the use of PrEP, numerous individual and structural barriers need to be addressed to facilitate access to PrEP. How does this answer his objective? It's making a statement, but it's answering his objective. Now let's look at conclusion. Remember the conclusion, you will answer your question and you make a recommendation. Although MSM and it's just 2 sentences, answer your objective and make a recommendation. It says, although MSMs are interested in the use of PrEP, how does that answer the objective? Is there an objective? How does it answer? And then recommendation. Numerous individuals and structural barriers need to be addressed to facilitate. Now let's look at B. Conclusion B. Score that person, or all of us, let's call, is over 1. And conclusion B. The majority of MSM and female sex workers identified the need for PrEP to prevent HIV. The barriers and challenges to PrEP access can be addressed through training of providers, expanding access to PrEP to populations beyond MSM and female sex workers, and public awareness creation to destigmatize PrEP use. That person, in 2 sentences, have answered the objective. Recommendation. Further studies are needed to develop models for PrEP delivery in Nigeria. So this is 1 mark. Guys, call this person. Conclusion B. All right. So, Oguyemi, you are going to give me the average of your score for abstract A, and Elizabeth, give me the, I'll give you 5 minutes while you are calculating. So for those of us that will write abstracts for lessons learned, some conferences ask for lessons learned rather than results. So this enables us to share field experience. And these are usually for many people working in the NGO sector. It is best to handle this lesson learned as a qualitative analysis and cluster the lessons learned into themes. Report the themes linking it to a theoretical framework. If you can think like that, if you're in the NGO sector, you must think about theoretical frameworks and there's something, those theory kind of things, you must link it. It gives it power. So this is how you write. This is that same study that we did. This is how, if it's a lesson learned, how you write it. And I underlined it that we observed. Remember that those other ones, they will collect quantitative, qualitative, they will use statistical tools to analyze and do that. When you say your lessons learned, this is our opinion. It's less objective. We observed that there were MSM and female sex workers faced with structural, individual, and biological challenges. I have grouped it into teams. So all those stigma, poor quality, HIV counseling, I put it into structural. All those drug costs, transport costs, I put it into the individual. All those drug interaction, I put it into biological. So I'm making it readable rather than writing all this long list as lessons learned. As lessons learned, we observe, because that's what it is. You didn't do an analysis. So it must be clear, you didn't do data analysis. It was your perspective that is speaking to the lessons we learned. So we observe and we learn that MSM and female face structural, individual, and biological. The way I've structured it is a lot more powerful than if I'm listing all those lists without putting it into tips. Okay, challenges the uptake and use of PrEP. The structural and individual challenges were minimally reported at PrEP service points provided by peer-led facilities for MSM and female sex workers. Biological barriers were reasons for discontinuation of PrEP use for the majority of participants in both the peer-led and facility-led. Peer service points that provided individual counseling were less likely to report PrEP use discontinuation than service points that provided. So you see, when you write your lessons learned, it has to be delivering and it has to be powerful, because why? You are coming from a disadvantage point. You have no statistical analysis. Many times in many conferences around the world, this piece of work often ends up in poster presentation. Without learning how to present your perspective in a powerful way, it will be marked down. Remember that you have already lost 1 mark in 0.5 marks in your methodology because there was no data analysis. So you cannot score 6 in methodology. You have already lost data analysis. Then you come to lessons learned. It must be powerfully packaged. It must not be sentiments. This is where the big headache is when you are writing lessons learned. There's a lot of, the way you present it, the person will know that, you don't just wake up in the morning. It could have happened that you woke up and just put it together without anything. It must be packaged with a lens. I've looked at it through lenses. I've looked at it as individual, biological, structural, because this is how we frame our responses in Nigeria. I don't know if I'm communicating. If I'm communicating with somebody here, can you just wave your hands? Use the animation and wave your hands. If I'm communicating with you, okay? I would like to know if I'm communicating with people. All right. Thank you, Kende Bello. I seem to be communicating with you. You are the only one I'm communicating with in 95 participants. Okay, Adebayo says I'm communicating. Thank you, Yusuf. All right. I'm trying. I communicated with 3 out of 95. That's a failure, but I guess I tried. Okay. All right. Thank you, guys. So I'm very much coming to the end of my session. There are common flaws that you must avoid when you write your abstract. The commonest flaw which I see from Nigerian abstracts is that they tell you that your abstract is 350 words and the background is 150 or 350 words. This is the commonest I see. Background of 5 to 6 sentences. You write an essay with a background rather than 2 statements. It's the commonest flaws I've found. Please, once again, background is just 2 statements. Another flaw that I find is poorly stated objectives. Once the objective is poorly stated and you cannot link it, then, it's almost gone. It's almost like gone because the methodology, you're going to lose your 3 marks. And this is where native intelligence matters. Every single person that reviews abstract as of today are human beings. They're not AI. They're not robots. And therefore, they have emotions running through them. They read your background. They're already upset with you. They read your objective. They're already upset with you. They will, when they say people should review abstract, I don't know if you're there. If anybody is here, you are reviewing 100 abstracts, 100, 120. That's what they tell you to review. Then they don't give you 5 abstracts to review. 100, 120. Then one person is annoying you with background on objective. You think you just, when you finish the objective, just give 0/10 and go. Let me go to the next one. So you must be native, intelligent, smart. Don't upset your reviewer with your background and say they will understand. They don't understand though. And you know what happens? Go and check it. Many reviewers are reviewing at the last minutes. By the time it's closing tomorrow, that's when they're reviewing their 100 abstracts. So they don't have time to be wasting with somebody, because at the end of the day, the selection is also limited. When you receive 1,000 abstract, there's only space for 50 presentation and 300 oral abstract. Look, when your own is lost, nobody is looking for it. And I tell you, it's tough. When I started the world of abstract, if you get 3/5, you can get a space in oral. I was at ICASA last year. 4/5 did not get a space in oral. Can you hear me? 4/5 did not get a space in oral. The last time I went to IAS conference, there was a score of 4.7. Yes, the highest abstract scorer, 4.7. You know, he could not get a space in oral. Why? Despite the fact that his work was beautiful, they couldn't find a team around his work. He had to go to oral, poster. So follow instruction and make it well. We are human beings. When AI starts to mark, maybe things will be different. Another thing that is a common flaw is that there's no link between objective, the method, the result, and the conclusion. You can see it with, I'm sure, abstract A will not make it to oral. And the method is written with room for suspicion. That word is it's so common for that lesson learned. Let me tell you the kind of thing they will write. We recruited 100 participants. The mean age is 25. They won't put standard deviation. Everything is always rounding. Everything is always round figures. You will just suspect that this person woke up in the morning and wrote this abstract. It looks like it is generated, it is fake. You write to me, there's no standard, there's no link between things, and everything is round figure. You are always recruiting 100 persons. 20 people decided to eat, 25 people did it. It looks like fake, and it's not going to go. And recommendations are not linked to findings. They're just extraneous. Then grammatical error. Jesus, please. You upset people when there's grammatical error. Past tense, misplaced, no commas. These are the common flaws. My final words. Please know that abstract writing is a skill. Everybody can. Every single one of you are a genius. You can write it. Nobody was born. It's not an inherited trait. We learn how to write. And therefore, if it's a new skill for you, acquire it. However, please note that when you start submitting abstracts, you are a scientist, kind of, and you must protect the integrity of science. Never write false abstract. Don't go and copy somebody's abstract and present it as if it's your abstract. Don't write false things. Don't generate information that is not true. Why? Because this information in abstracts are used to develop policies and programs. And therefore, if you're telling us false things, we're going to be building falsely on the presentations you've made. You have a role to protect the integrity of science. Finally, I'm going to ask you to go to Google Stroke Checklist on conference abstracts. There is a guide there, a written guide. This is the guide that everybody in international conferences used to mark abstracts. And check out if there's anything there that I've not said or anything that I've exaggerated. On this note, I want to say thank you. Thank the listener. Before I go off, Oguyemi, what was the score for abstract A, please?
Okay.
Oguyemi, what was the score for abstract A?
Okay.
Yes.
Thank you very much, ma'am. So, what I have here for the background,
no, just the total. Total.
Okay, the total. Okay, so the average score is 2.2/5.
2.2/5. And that person, despite the fact that you wrote 5, you can't even make it. You can't make poster. 2.2/5. You failed, Abby.
Yes, that's a failure.
Yes, that's a failure. So you can't even make it. Despite the beautiful story. Can you imagine? Yeah, the one that marked he didn't even make abstract. He will not say, they will cheat me, Elizabeth, what did abstract B right? Good.
What did I do that?
So abstract B got 3.6/5.
Despite all the beauty, this person can only make it for poster. Despite all the beauty, all of you, 100 of you, you put the scores together and this person 3.5/5, it can only make it for poster. What can you learn from this? Poster writing is skill. You must take cognizance of every detail for you to get all the marks that will get you. Not beyond, if you want to get poster, objective B got poster. But imagine if you wanted to do oral, it fell short of oral. That is because he or she was losing points. It is E. If it's a she would have gotten all the points. This is E. He lost all the points by writing it at the last minute, by not giving the peers to review, by not taking cognizance, not going to check the Stroke checklist and following the order. Yes, so Daisy was E. If it's a girl, they would have scored 4. We would have scored 5. All right, guys. I need to keep quiet now. Thank you very much. I had fun. I hope you had fun. Hand over to the organizers. Thank you very much.
Right. Thank you so much, ma'am. Indeed, we had so much fun. Yes, thank you so much, Professor Moreni Careful for that very engaging session. Definitely, we know that we cannot overemphasize the need to be able to write good abstracts, especially if you want to remain in the academic environment. Thank you so much, ma'am. I'd like to welcome, we have participants all the way from Zimbabwe, from Malawi, and from Kenya. Thank you so much. It's nice to have people outside Nigeria on the call as well to learn. Thank you so much. So now we have a couple of minutes left. Our session actually shouldn't span beyond 1.5 hours, but it appears that we really had a very...
I forgot myself. I was just having fun. I'm sorry.
We were actually learning. We're learning, ma'am. So we can't complain. So what we'll do basically, we'll just want people to put their questions in the chat box, please. So it's easier for us that way, and we don't waste time having people come up to read, to say their questions themselves. So Elizabeth, would you please go to the chat box and see what questions we have so that Prof can quickly take them. So in another 5, maximum 10 minutes, we should round off this session. Thank you so much, Professor Careful. Thank you, ma'am.
Okay, thank you, Dr. Guilherme. Thank you so much, Prof. That was very engaging, very enlightening. We don't have a lot of questions. We just have question around the slide deck and the recording of the session. So participants want to know if they would have access to the slide presentation and the recording after the session.
Yeah, I think I see one question here. It says, is it compulsory to have a recommendation for a dissertation abstract? Every abstract ends, your conclusion is 2 statements. How you answered your question, objective, and a recommendation. If you write a manuscript without it, it's not going to flow. At least in the key one, what was presented here is what is required for top journal, top. SAYPHIN is really top. It's a page setter. So if you want to get it through, remember, if you don't write your recommendation, you're losing 1 mark. You're losing marks. The marks come. Go check that strawberry that I recommended. Go and check it. You understand what I'm saying? That's the international standard. Just Google, you see, that's the international standard. So yes, adhere to it. I'll encourage you to do it anytime, whatever abstract you are writing for. Thank you.
Thank you, Prof. We have a question here that says that, can project-based research abstracts be written in retrospect?
Yes, I would assume that what you mean by retrospect is that the study has been done and you're writing about it. Yes. So yes, you can do that. I mean, you've done your study, you've done it. Even if you did it in 2014, remember that you write that this was 2014. You must write the date of collection. That's it. If you did it in 2019, you just write the date. It was 20, so that the people can contextualize the information you are sharing. Okay? Yes, you can. Yes. Thank you.
Okay, Prof. Prof, this question, I don't know, okay, I think we've got a question here that says, if you can throw more light on including dates in the methodology. You also said sample size should come in the results and not in the methodology. So I think it's referring to when you talk about the dates.
Yes, well, you don't write sample size in an abstract. So I'm not talking about main paper. Sample size is not expected. You don't talk about how you calculated your sample size in the methodology of an abstract. No. But your sample size is just so 150 participants were recruited, of which 2 were male and 15 were of socioeconomic status, and 13 had no teeth in their mouth. That's how you report your results. Okay, so yes, and you must.
Thank you very much, Elizabeth. Do we still have any more questions, 1 or 2, before we?
We don't have any more questions. I think this is just a question talking about, can we have a community of like-minded people collaborating and networking for future writings? So I think probably like a space where people who want to write project-based research or research abstracts can get support and collaborate and work together. Prof, I don't know if you know of any community that is in existence.
I can share that. I think 1 or 2. I run a manuscript writing up, and that's all we do. We teach ourselves how to write manuscripts for Q1, Q2 level journals. I could share the link with, I'll share with Professor Olumide, and I think she can share it with everybody who might want to join. I'll share the link with her. So I do this with groups of people who want to. And then there's the Girls Club. The Girls Club also does this, but it's exclusive to females, completely exclusive to females. where they support themselves for, like now, if there's an abstract, you send it to that space, people will review it for you. I think they're currently jointly writing 2 manuscripts. They do a lot of things together, but it's exclusive for females because females have peculiar problems that they need the support of each other. So those are 2 places. I'll send the links to Professor Lumide, but please, for the Girls Club, it's just for females. I can get that. And regularly, I know the Faculty of Dentistry, which I heard does this training, but it's fee paying to support abstracts. It's 10,000, 2 sessions where they teach you this, and then they tell you to send your abstracts. They review the abstract. The second week, they go through the abstract with you and address shortcomings. And that's done regularly by the Faculty of Dentistry. So I think there are multiple resources. I know ICASA is going to do another training on abstract writing soon. Thank you.
Thank you, Prof.
Thank you so
And
much.
I enjoyed myself thoroughly. Thanks for allowing me to play. You should have controlled my time for me. Bye, everyone.
It's fine. Thank you so much. So, well, that'll be the end of the question and answer session. Thank you so much, everyone, for being on the call with us today. Definitely for those who are asking if they'll get the recording, yes, the recording will be sent to the email that you registered with. So, but before we round off, I'd like to call on Dr. Adebayo again to please give us the closing remarks and vote of thanks. Thank you so much, sir.
Thank you, Dr. Ogunyemin and Elizabeth, for job well done. I believe we all will agree with me that it's been quite engaging this afternoon. It is true. We spend so much time, but I believe that what we've gotten now is worth more even than what we could imagine. And so we apologize for taking your time, but all the same, we need this stuff. It's been so practical, so enlightening, so refreshing. And what we need from us is to run with it. The question that somebody asked about if those that have poster presentations are of low quality, it's still about the essence of this abstract writings webinar. The ideas could be great. There could be depth in the research. But if the writing is of low quality, there is no way to fall below the expectation. Prof had given certain hints on how scorings are done. She's an international reviewer. She also reviews for SAYPHIN. And some of us are also reviewers. In fact, what she's given this afternoon is both for reviewers and even those that will submit abstracts. So we all have learned one thing or the other. So please go back and utilize the knowledge, the skills, whatever you have acquired from this webinar, even to prepare your abstract for the upcoming conference. At this point in time, all I have left is to thank as many as have really, really made this happen. Once again, Professor Morenike Folayon, thank you so much. You've never disappointed us. You've really given it to us. I said earlier that she's going to be building on what we had last week. And that's exactly what she has done, really. We've had, practical steps and been able to really engage ourselves in how we score those abstracts. Then for our moderators, thank you, Dr. Oguyemi. Thank you, Elizabeth. I'm also thanking those that moderated last week because it's a work in continuum. Our attendees, thank you for coming. If you are not here, we'll be speaking just to the ear. And for the fact that you are here has really made a day. And well, you've been patient enough to also, listen all through. Thank you so much. For the organizers, SAYPHIN, on behalf of the president, Professor Olusegun Fatusi, the general secretary is Professor Lumide. Like I said, she presented last week. We're really thanking the scientific committee for making this really happen. This is the end of this series. And please remember that you need to package your abstract together at this point and submit. The deadline for submission of abstracts is 31st of May. And now that SAYPHIN website is active. It's working. Somebody said it wasn't working earlier, and I tried it. It's much active. And then the link for the conference registration is also active. And I will request that the secretariat, the program officer is also with us in the person of Mrs. Kende Taiwo. She will also send a follow-up email to everybody with regards to how you can become a member and how you can also register. Once again, thank you everybody for being a part of this very much engaging abstract webinar, abstract writing webinar the past 2 weeks. Thank you. Bye. Over.
Thank you very much, Dr. Adebayo. Thank you, everyone. Just a quick one. Could you all please just put on your cameras so that we can have a good picture? Elizabeth, I don't know if you could help with that so that we can have good pictures.
Okay.
Yes, I can see beautiful smiles coming up. Thank you. Okay. Elizabeth, are you able to capture that?
Yeah, 1 minute.
Okay, thank you.
Yes.
Okay. So the next
Another
batch,
shot.
another set. So if you've turned on your camera initially, you could turn it off now so we can have another batch come up. Thank you. Let me turn off my camera too.
Oh, doing great.
Okay.
Okay.
Yeah. Thank you so much.
All right. Elizabeth, how are we doing?
Yes, gotten it.
All right. Okay. So do we have everyone? Are you able to capture everyone?
Yes. Let me just one more time and then.
Okay, one more time, please. One more time. Thank you. Okay. Thank you very much, Professor Maureen Kefalayo. It's nice to be able to put a face to the name. Thank you so much, ma'am. Thank you. So we look forward to having everybody at our conference in August. Please make it a date with us. You've had a foretaste. Definitely, it's going to be much more better at the conference. Thank you, everyone, and do enjoy the rest of your evening. Thank you. So bye for now. Elizabeth, are there any comments from you?
Thanks, everyone. It's been a pleasure being your moderator, co-moderator today. We look forward to seeing you at the conference. So please check out the website, conference.sayphin.org for all information regarding the conference, registration, participation. And don't forget that the deadline for submitting your abstracts is the 31st of May, 2023. So go and start working on your abstracts. Thanks, everyone. Do have a lovely day ahead.
Thank you so much.
Thank
Bye
you.
for now.